I have been with CTN for a little bit more than 3 years now, and I'm program manager. And before the COVID, I was mostly managing CPUC funded programs on the East Bay. So that's why I haven't been really involved in San Francisco. But since COVID, some of the CPUC funded programs I mentioned on the East Bay got, on hold. And so I got pulled into Home Connect program we put together with my team, a Home Connect program, which you can learn more about it if you haven't heard about it on our website. And I'm also working from home now, doing a lot of curriculum development, modify a lot of existing curriculum from in-person to changing them to distance learning. Also doing a lot of train-the-trainer materials. And this is the Tech Allies 2.0 for health. The Tech Health curriculum is one of them that I worked on. So, and Tech Allies 2.0 for health. This is a program, actually partnership. We're partnering with Little Brothers and UCSF, and I see Kathy and Debbie both on the call. So I'm sure they can answer some questions that I may not be able to. So, and the little agenda for my 15 minutes presentation. So I'll go over program overview. We did a Tech Allies 1.0 a few years back, and this is Tech Ally 2.0 for health that I'm working on. And then I would do a quick overview of the curriculum, and then talk about the train-the-trainer piece. Okay, so for Tech Allies 1.0, it was, I think, 2017, 2018, correct me if I'm wrong, Kathy and Debbie. And roughly 100 seniors were trained, and many of them are homebounded. So the device that they used were some refurbished iPad 2. Besides this device, we also provided them with free Wi-Fi at home. And the training was very basic. So getting to know the device, using the internet to do simple searches, email, camera, FaceTime. And these are one-on-one lessons in person back then. And as I mentioned, this is a three parties collaboration. CTN was responsible for curriculum development and train the trainers. Little Brothers, they enroll all the learners, and they recruit and handle the preparing of the volunteers. And UCSF was involved to do the program evaluation. So for 2.0, this is happening currently, and it will go into 2021. And the goal is to train 50 seniors, and most of them I think will be Tech Allies 1.0 graduates. And the device we're using this time is iPad 5. I think the iPad 2s that were used a few years back, they went out of date. A lot of programs stopped working on those. So there's, I think, one reason why there's this program come around again, the Tech Allies 2.0, is to update the device. And this time we have a 7-hour beyond the basics curriculum. And the priority is to focus on communication and telehealth. And one feedback that we got from 1.0 is that we need more graphics and step-by-step guides in the training booklet. So this is, so again, CTN involved to do the curriculum. We developed the curriculum, and as well as the train-the-trainer materials. And I think 1.0, what we did was live sessions, like synchronous training for the trainers. But this time around, we're doing what they call it as asynchronous. So it's pre-recorded, some videos, and so the volunteers can go through these materials at their own pace anytime they want. I think Debbie is still doing one synchronous training with the volunteers to give them like a background. I'll talk more about the train-the-trainer piece in a little bit. So same, UCSF is still involved in the evaluation. So This is the program overview of 2.0. Now the curriculum. So I mentioned this is a 7-hour curriculum, and lesson 1, we do a quick review of the basics, because we don't know if the seniors have been using the iPads that they got from a few years back. So we want to make sure that they all have, the basic skills that they need in order to do these lessons. So we go over internet search, email, and camera. And if the seniors have been using the iPad and know these skills and already, we give them options to learn something new like YouTube, Siri, and iMessage, which I think they didn't cover in 1.0. So we have a little bit of flexibility here. So then lesson 2, we go into video conferencing, FaceTime that they learned in 1.0. So it was a review for them now, and we teach them Zoom because now everyone uses Zoom meetings. So lesson 2, lesson 3, a big part of this 2.0 curriculum is about the patient portal. So we have 2 parts. Part 1 is to explain a little bit what a patient portal is, and then helping them creating a patient portal. So one big challenge that I think Little Brothers faces and we faces is because the seniors may be using different patient portal depending on their on the doctors or the clinics that they go to. But fortunately, I think most of them use one of these 3, MyChart, Kaiser, or Telehealth. I think Debbie can give a little bit more information. We do discover some learners don't use one of these 3, and we're trying to work with them, work with Little Brothers and the seniors to see if we can maybe develop another one depending on what they use. So this is what we have right now, these 3 big ones, MyChart, Kaiser, and Telehealth. And part 2 of the patient portal lessons is to actually go into the patient portal with them once they created the account. So we explain what telehealth is. We show them, the main functions of the patient portal, including requesting and canceling medical appointments. They can view their medical records, view their past visits, test results, and also request prescription reviews. And on the left, you see that is one example of the booklet that we created. So we have make the graphics much bigger and clearer this time, and we provide a lot more step-by-step guides and clear pointing out where things are. Because these lessons right now are due remotely, and we feel that it's much needed, especially during this time, to have a very detailed booklet for the learner to follow along. I don't remember the exact pages, but I remember it's like over 100-page booklet for the learner for these 7 lessons. Okay. And lesson 5, 6, 7, we go through some health information websites, and including in that we throw in some misinformation, because a lot of times seniors don't know what they see online is true or not, and they would just share everything that they receive or they see. We want to make sure that they only use reliable health information websites and resources online. So we touch on that topic in lesson 5. Lesson 6, we introduce them to some useful health-related apps, like some stress management, some brain exercises, etc. Lesson 7, the last lesson, we touch on advanced care planning. So the volunteer won't do like actually do the advanced care planning with the learner, but we introduce them to this idea in case that they haven't heard of it or haven't thought of it. And then we end the lessons with some online resources and fun stuff for them to do. Okay, so that's the 7-week or 7-hour curriculum. Any questions, comments?
So the volunteers that you sign up to do this, they go through the training with CTN staff, and then they go and do this one-on-one with their senior.
Yeah, I will go into, actually I can answer that question with my next slide. So this is a trainer. 1.0 is, I think, is done by CTN and Debbie as well, for Little Brothers. And this time we started with like a live sessions that Debbie do with all the volunteers in groups. And then CTN prepares some videos and some like question and answers, things that they can, the volunteers have to go through at their own pace. So there are two parts, one part of three parts. So one part is the live group sessions. And then part two is adult learning principles. We want to make sure that all the volunteers understand the challenge or know how to work with adult learnings, adults, especially seniors, what the challenges are and how to handle the situations. So those are videos and they have to answer some questions. It's about 1.5 hours long for this part. And then after they're done with that, they will have to go through the curriculum. It's also a video and also a PDF trainer guide. So on the left, you can see it is the curriculum walkthrough is on the web, and yeah, so they can download the trainer guide and also go through the videos one by one, lesson 1 to lesson 7. And on this next slide, this is an example of the trainer guide. Then we have this part, week 2. So to begin, it may be a little bit too small, I don't know, for you to see on the left. For week 2, we always, beginning of the lesson, we want to do a quick review of what were covered from the previous lesson. So always start with a review. And then we'll do a check-in, ask questions, basically to find out what the existing knowledge or experience that the learner have, the seniors have with the topic. And then we'll go into teaching the topics and then end with some homework that the learners have to do. So, and one thing that we emphasize during the train the trainer is that this is really a guide. Depending on the learner's skill level or the interest, the volunteer can actually adjust the curriculum a little bit based on the trainer, based on the learner. Page on the booklet for the learner, we have some trainer notes. So it helps the trainer to prepare themselves to teach each lesson. I think that's it. I'm open up for questions.
I just have a quick question, Sabrina. That was very interesting. This is Andrew from the Tech Council. What was the general kind of experience of individuals with patient portals? Before, did any of them have any experience prior to this program, or was it all new to them?
I can take that. This is Kathy. No, none of the older adults that are working in this program are connected to the patient portal.
This is Carla. I have a couple of questions. You mentioned the refurbished iPads, and Cami, you noted in the chat box that you used a company called E Squared to configure them. So a couple of questions on that. What do you load on the iPads? What do they see? What in terms of user experience when they get onto it?
I can answer that.
Great.
So we have a couple of apps pre-installed on the iPads before they're shipped or delivered to the learner, including a share screen app called TeamViewer. Unfortunately, we just found out that it's not working with these iPads because of an operating system issue. I tested them with an older operating system and it worked. And we found out that it's not working on this newer operating system. So we pre-installed Zoom on the iPads also. So we switched to Zoom because for the distance learning, it's important for the learner and the trainer to see each other and also to share the screen to facilitate the learning. So able to do that with Zoom. So Zoom is pre-installed, and I think YouTube is also pre-installed. I think that's pretty much the programs that are pre-installed.
So these were users that already went through your program, right? So they already had an older iPad with their program. Like, did you set up Apple IDs for them and email accounts, and then, or was it their own that you used?
So for 1.0, it was set up with the learner together. So it's their own. But a lot of them, we found out that they forgot the Apple ID. So for this time, so 2.0, we preset all the Apple IDs for them.
So you changed their Apple ID to a new one?
We used a generic one, so it's not like with the name. It's a generic Apple ID. I can also give you a little bit more information about like train the seniors using Zoom, because we do that for our Home Connect program. So for our Home Connect program, we teach the learners using Zoom, and it usually takes maybe 30 to 60 minutes to actually get them on Zoom. They struggle with audio. So maybe they're able to join Zoom, but they cannot turn on the mic, join the audio, or they cannot turn on the camera. Yeah. So it would take that much time to actually get them on Zoom. But then we try to do weekly lessons with them on Zoom once they acquire the skill. So to make sure that they continue using Zoom, otherwise they will forget. And we encourage them to join other online activities on Zoom that's available. Offered by you guys.
So I have a question. So two questions. So regarding the iPads, is it generally agreed upon that they're easier to use for older adults than other tablets? Does anybody have an opinion on that?
Well, I'm biased because we train on iPads. So the feedback we get from clients is they really like the iPad. I think it's big enough, and they seem to like it. And a lot of our seniors have started having iPhones themselves, so they feel kind of comfortable with that Apple system. So that's been our slight experience. Yeah.
We, as you may know, we use Android for our Home Connect program, and depending on the size, so we strongly recommend bigger screen, like 9 or 10 inches tablets, not the 8. And our seniors also like the Lenovo tablets that we use, Android tablets that we use for the Home Connect. Slight difference, but I think the Android system now also have a lot of accessibility functions. So the cost is big difference, I would say. Right now, our Android tablets cost around between $150 to $200. So you can consider, Android if budget is an issue, you want, a bigger reach. There are some Android tablets that are, even less expensive. We haven't tried those, and those are like off-brand that we don't know much about. But like you can choose Samsung, Lenovo, the bigger brands, and those are usually pretty reliable.
No, I did have a question. It was maybe as part of your formative research, just curious about Sutter, Kaiser, and the third provider, UCSF. Are they all using the same kind of video platform for telehealth? If you go to the patient portal, that is. I know you mentioned Zoom and kind of, teaching people to use Zoom, but I don't imagine Kaiser would use Zoom as its kind of video telehealth platform.
Yeah. So UCSF does use Zoom.
Okay.
Kaiser have their own, but they also make options for the patients to join on Zoom. Because I'm Kaiser patient, so yeah.
I know that the Curry Clinic doesn't use video. They're not set up to do in the community clinics to do video telehealth right now.
So since we're on the video thing, my other question was, our IT department is kind of pushing us to use Microsoft Teams and some of the other already bundled video packaging. But we are suggesting that Zoom is actually easiest for older adults to use. Would everybody concur on that one? Good, I can say the SF Tech Council says. Okay, thank you.
I think Microsoft Teams, I mean, we've gotten into like people get, they get some pop-up windows that aren't as clear. Zoom has a real clean interface that they have to almost just click one thing and it's done. And Teams is, you get into your Microsoft account and, do you want to download this? I mean, once you download the Zoom app, you're kind of ready to go. And that's its, positive. That's a positive, I think, for seniors.
Yeah, and you don't have to have an account to join a Zoom meeting. Yeah. So that's a big benefit.
Yeah, thank you. Thank you. Edith, did you have something?
Just one last question about helping participants enroll in Internet Essentials. So do you have a special relationship with Comcast where you can enroll through a particular person that you have a relationship with, and how long does it take? They have to install it in the home, is that correct? Yeah. So somebody has to go into the building, into their apartment. Not anymore?
No. They don't. They've really restricted that.
Okay. Can you tell
they're
me?
They're now just shipping. Well, I'm sorry to interrupt. I mean, they ship the Xfinity box to the person, and they don't do home visits, or they haven't been.
Really? How about if they don't have a jack? Like, I mean, they may have a regular
Comcast, jack, but they won't set it up first unless they know that the apartment is internet ready.
Mm-hmm. Really? Okay. So
our staff person Al says, they've been going in and installing.
Oh, okay.
I was surprised to hear that as well.
They weren't from March through when we were asking in the summer, they weren't. So maybe they're back in. That's good to know.
I had one quick question before we turn it over to Marie, and that has to do with this information that you presented, Sabrina. Is it available on the CTN website in terms of Train the Trainer resource and the guides and things like that?
Not at this moment. We haven't put this telehealth curriculum information on our website. What you can see on our website is our Home Connect program information. But I can check with Tammy if we can, put it out.
Okay. We wanted to test it out first and run it through a few learners and work out the kinks before making it more widely available. And then we'll make it available in other languages as needed.
So we're probably looking at the new year then in terms of when it will be more widely available and people can check it out and use it and that sort of thing.
Yeah. And it will stick with those 3 portals. Okay. There's another portal that Little Brothers is interested in adding, and we just need to get access to it to be able to do the screen grabs.
Okay, great. Thanks.
All right. Well, thank you, Sabrina. That was very, very interesting. Appreciate it.